We'll just do one more minute and then we'll do introductions. I loved the guesses. The answer that I had, and all those would have been right. The answer that I had was nothing. It's on the house. But so a little silly joke. Okay, so we can go into introductions. So my name is Charlie Voss. They, them, I work for SEPA and I also chair HSSN. And then anybody else on the team wanted to introduce themselves? And if you'd like to put your name and organization in the chat, you're welcome, and your pronouns, you're welcome to do that as well if you'd like.
Good morning, everybody. My name is Lindsay Dent. I use she, her pronouns, and I am the training coordinator with Washington County Homeless Services. I'm just jumping on here to do that quick reminder. It's been, I think, month 3 now that we are offering public comment. So if you are interested in speaking in public comment setting for up to 2 minutes, please direct message me in this chat. If you prefer to have public comment, I see Meredith just put a link there. If you prefer to post a public comment rather than speaking in this meeting setting, you're also welcome to do that.
Okay, great. So first up, we have Leslie Gong from, talking about the medical expansion waiver. Leslie, whenever you are ready.
Okay, good morning, everyone. Should I just share my screen? Okay, let me see which. Okay. Hold on, let me just see if I can do this. Okay, I don't know which screen do you see? Do you see one with like?
You see the homeless services, it has the date on it.
Okay. So I don't know if I can, does that look okay? I don't know how to put it into.
Yeah, definitely.
Okay,
you can do it like that.
Okay.
Yeah.
All right. Okay. Sorry about the technical logistics and setting up. So I just wanted to present on the Medicaid 1115 waiver, specifically around the housing related social needs or HRSN housing benefit. I'm going to switch to, sorry, I'm having difficulty navigating here. Okay, and I am the Health and Housing Integration Program Coordinator for Washington County. So what I wanted to do today was go over the 1115 waiver at a high level, specifically talking about the housing benefit, and then talking about the concept of a hub model or a network manager model, and what that may look like as far as a timeline, and then we'll leave room for some question and answer. Okay. So the 1115 waiver, so Medicaid is a medical assistance program, federal medical assistance program that's free coverage, um, free coverage for eligible members across the country. And it comes with some rules where with the 1115 Medicaid waiver, we can adjust some of those rules with the permission of CMS or the federal government. Under the Medicaid waiver, there are different types of plans, but one of those plans is the health-related social needs service. And I would encourage you, I put throughout the presentation or the document that you may have received with links to learn more about the waiver, so you can see what other coverage or what other plans are included in that waiver or that benefit. Okay. Okay, so in the HRSN, I'm going to call it HRSN moving forward. In order to be eligible for the service, you would have to fall under one of these covered population, and that includes individuals who are homeless or at risk of homelessness, have at least one of the clinical risk factors that are listed here, have one of the social risk factors, which that includes an individual who is homeless or at risk of being homeless as defined by HUD. And then also there are individuals who may be eligible for climate support and or a nutrition support. So that includes so those who are meeting the USDA definition of low food insecurity. The HRSN includes climate supports, housing supports, nutrition supports, and outreach engagement. I'll just add a little bit about, since it's explicit here on the slide about what climate supports would be included. Nutrition supports includes tailored meals, medically tailored meals for specific health conditions, funds for purchasing groceries, hot meals, or produce, and it also includes nutrition education. Outreach engagement is really a service that links members to other Medicaid and or non-Medicaid benefits. And then the way that OHA or Oregon Health Authority is implementing this benefit is through a phased approach. So in the first phase, climate services or climate supports was launched as of March. Upcoming is the housing services supports, which is specific, which is focused for those who are at risk of becoming houseless and prevent more people from entering into the chronic houseless population. So that is set to be implemented November of this year. The next will be nutrition, which is early next year. And then still yet to be determined is the population to include those who are experiencing homelessness. And that timeline is to be determined, but it's really expanding the housing supports. So really focusing on the phase 2, those who would be eligible as of recent. OHA has made the criteria to include those who are currently housed, need support to maintain current housing, they have a lease or written agreement with a landlord, they have an income 30% or less than the AMI where individuals reside, and they lack the sufficient resources and support networks to prevent homelessness, and then as mentioned before, that clinical risk, at least one of the clinical risk factors. Okay, so what this benefit, how it's being funded is about 1.1 billion for this demonstration. 119 million is towards community capacity building funds to help support community partners and others who are involved in the demonstration to be able to build up the capacity so that it can so this benefit could be implemented. And then the HRSN services about 904 million to cover those different supports listed there. Okay. So about 904 million available to provide these HRSN needs services to eligible individuals through reimbursement to providers who are delivering these different types of supports. So I mentioned that I will be focusing more on the housing supports. So in that phase 2, that service includes rental assistance or temporary housing. That includes rental and utility assistance for up to 6 months, home modifications, which includes ramps, handrails, environmental remediation, and that may be pest control, chores, heavy duty cleaning, synthetic blinds, tenancy support services. So that could be eviction prevention, housing focused navigation, and or case management. Outreach really includes that engaging OHP members who may be eligible, and that includes verifying whether they're tied to a coordinated care organization or a CCO, or an open card enrollment. So if they're not tied to a CCO, so they'll work directly with OHA. Sending HRSN requests to the appropriate CCO or OHA for open card, and then providing information and support to connect them with other services like medical, peer, social, education, and legal. Okay. So those who are involved in this demonstration, there'll be service providers and vendors, of course, the member who is eligible, care coordinators, which are primarily with the health plan side, and then community connectors. Those are entities that are involved with identifying or being involved in the front end, which is the outreach and engagement. In order to be an HRSN provider, there are different qualifications. So being accessible to serve the member, demonstrate your ability and or experience in providing the services to at least one of the priority populations. Show that you have a qualified service delivery staff, providing trauma-informed, culturally and linguistically appropriate services, demonstrate responsible financial practices, follow the applicable federal and state laws, enroll as a Medicaid member provider in the Medicaid Management Information System. This is how we would identify Medicaid members and then track billing, and then being prepared to deliver the housing benefit. Again, there are links throughout the presentation if you want to learn more about how to become a HRSN provider and what that journey may look like for a member who is receiving the benefit. Okay, so there were in the community capacity building funds, there were different ways that one could apply for those funds. And there was this concept of a hub or network manager. So again, the intent really is to work with the CCO and OHA to deliver the service. That could include a hub or network manager helping to support a network of HRSN service providers. There could be service providers who have different expertise and readiness in delivering the HRSN benefit. So that could, the first year could look like as starting with an initial pool of service providers, and then throughout the demonstration, really expanding it so that there are more providers who can be able to deliver the service. The demonstration for the housing benefit goes up until November 2024, up until September 2027. September 2027 is when the demonstration would end. Below is really a workflow that in general, how OHA had designed the workflow. So really that outreach and engagement, identifying eligible members. So if you do find an eligible member, an HRSN request would be submitted. On the health system side or health plan side, they would do a screening and verify and authorize and notify the member whether they are authorized to receive the service. And this next step could be variable, but once it gets authorized, it could be referred to a hub or a network manager to really triage the referral, and then send that referral over to HRSN service providers to deliver the service. This is where Washington County as a hub or network manager could help support providers in the coordination of the services. And then once the service is delivered, similar to current practice is reimbursement or payment for the services that was delivered. So in this instance, it's the service being delivered is a billable service under Medicaid. And then here I put in some links, what you could see with the climate support as far as how a request form would look like, and information sharing. So this is really just like a timeline of a proposed timeline of what activities could look like over the summer before November, before the November launch date. So community capacity building funds were was closed last month. And now we're in this stage of designing and planning the infrastructure. There will be parts of developing policies and procedures, contracts and staffing plan, and then ensuring that there's training ahead of the go live date, which is in November 1st. Over the demonstration, as I mentioned, expanding over those who are eligible, as well as the network of service providers. So this, I'm opening up to questions. And then also if you wanted to learn more or get more updates, I put in some links here to OHA, where you can ask questions or follow in their partner sessions that they have, I think at least twice a month. And then I also wanted to put a plug for the Behavioral Health Resource Network, since it's affiliated with Health and Housing Integration. Lindsay Dent, if you have, is available to answer any questions about that, but it's Wednesday, June 12th, public service building, and there's going to be a virtual option available. All right. I think I still have time for questions and answers, but I'm opening it up for that.
So my question is, how do I get a copy of your slides? I need better than photographic memory.
Yes, the slides are available on the HSSN website, and yeah, it should be there.
Thank you.
Mm-hmm. Any other questions? I'm going to look at the chat really quick. Thank you, Meredith, for putting the link to the presentation in the chat. I know it's a lot of information, and I think that what this planning has been going on for a while, and we're getting more into the details of the work. And so what I plan to do is periodically join this call to provide some updates, as well as weave in any other health and human services resources into the presentations as it relates to health and housing integration. right, thank you.
Awesome. Thank you, Leslie. We're a couple of minutes before, but Nicole, if you're ready, Nicole Sting is going to talk to us about local implementation plan annual update. Nicole, if
Thanks, Charlie. And hi, folks. I'm going to take a moment here while I share my screen. My name is Nicole Sting. For those that I don't know, I use she, her pronouns, and I'm the Strategic Initiatives and Relations Manager here at Washington County. I'm eager to talk to you today about what really is our work plan for the next fiscal year that begins on July 1st. For those of you that have engaged in our work, you know that as part of our supportive housing services programming, we submit an annual work plan to Metro that advances the local implementation plan that we as a community have made. So the latest update on that plan is what is the draft nearly final fiscal year 2024-2025 work plan. What this looks like, what we've tried to do this year is really embed all of our resources into one work plan. So we're not just looking at SHS in a silo, we're looking at our entire homeless services system of care. This includes resources from SHS, of course, the important resources and coordination work from the continuum of care side of things, and then anything related to the governor's executive orders or continuing the emergency response to homelessness. So we're funneling all of that work into one homeless services system when we think about what we want to achieve together in the next year. We're entering the fourth year of SHS. And when we started this work planning process, we took a quick look back. What did it look like? What were our major themes or goals for each of those work plans we put together? The first 2 years of SHS, it shouldn't be a surprise to folks, was all about building a system. We first added 100 shelter beds to our system. We expanded long-term housing options, and then we did that again the next year. We doubled shelter bed capacity, and we supported more than 2,500 people in their journey to housing stabilization. This current fiscal year, we've been working a lot on system improvement, sustaining the newly built system. We're fine-tuning our programs, making sure that folks have what they need to be successful. And that's going to continue in the next fiscal year. We've, again, rapidly built a system of care from scratch, and we know we have a lot of work to do to make it work for all. So the kind of theme of this work plan is really improving how folks move through our system, improving access to our system of care. And in a moment, I'll talk through what those goals look like. But just to take a step back and remind folks, SHS is a 10-year funding source. So we are nearing 30% through of our use of that fund source. We hope that the voters will expand it when it comes up to the sunset timeline. And to do that, we're committed to ensuring that our system is working for all in the community. And really, that's what we'll be talking about in the next few moments together. And I'll start with where folks often show up in our system. We have a few access program goals that's related to shelter, outreach, and housing navigation. You'll note we want to maintain our shelter capacity across 15 shelter sites. We also want to maintain street outreach capacity and support housing navigation for folks looking to move out of homelessness and into housing. We have some other kind of metric related goals. We're looking forward to opening one of our year-round shelters this upcoming year, likely the shelter in Beaverton. We're also working on and hoping to soon release a capital funding offering for transitional housing. So that's more long-term housing than shelter, but not quite permanent housing to provide wraparound services and supports to folks exiting homelessness. And we're particularly interested in the needs of folks in recovery or seeking recovery and being well supported in housing. So that's a focus coming out soon, and I'm sure we'll have more to share on that in the coming months. And then additionally, we're also looking at expanding phase 1 assessments and particularly thinking about partnerships with McKinney-Vento liaisons in our school districts and other public systems. Once we look past housing, we have some important metric goal, or past access rather, we have some important housing metric goals. We want to prevent 1,400 eviction, that's up from last year. Shallow subsidy support is a flat rate subsidy. We want to support 150 households. And then on top of that, we want to support housing graduations. And what that means is folks with an ARLA voucher that also have a housing case manager. We want to support them in continuing their ARLA voucher support, but perhaps graduating them from the level of service that they had at the beginning, and recognizing that they might not need that level of service anymore, and opening up a door for someone else to come into our system. We also, our housing retention goals remain the same at 85%. And then when it comes to placements, getting folks into housing for both project-based and tenant-based permanent supportive housing, we're looking at 450 placements next year as a goal, with 300 for rapid rehousing and an additional 200 households receiving move-in assistance. And I mentioned this was the year of system improvement. Those are the big, exciting numbers that people like to talk about, but really the work is going to happen when we think about our system improvement. As you heard from Leslie just before this was serendipitously timed. A healthcare system alignment is a huge goal of ours. The Medicaid 1115 waiver offers, as you heard, an incredible opportunity for us. So we're really leaning into that work in the next fiscal year. So I want to better leverage our by name lists and with our LC3s. Mentioned the strategy to graduate households, again, looking at our system health and how we move folks along and allow new folks to come into the system. And lastly, this is something we've heard a lot about from the public and a lot about from the Supportive Housing Services Stakeholder Oversight Committee. Telling the story of SHS and the work that we do in homeless services is hard, and we want to support our providers in telling that story, getting the word out there about all of the incredible work we've been able to do because of SHS. Not to say that there's no improvements to be made, but to say that this is our funding source is voter approved, and we need to make sure voters understand the impact these dollars are having and how they've changed our community. That's a big goal for next year. And then I'm ending with really what is the foundational work. Advancing racial equity and equitable housing outcomes is key to ensuring folks can move through our system. First and foremost, we're planning system interventions related to language access for non-English speakers. We know this is a challenge for providers. It's a challenge for folks in our system that don't speak English, and we're looking into solutions to increase language access and access overall to our shelter system. We're also working with our tri-county partners in Clackamas and Multnomah County on a regional equity lens tool that'll create some type of standardization with local color to review programs and ensure we're putting equity first and asking the right questions when we're designing programs and implementing investments. And last, we are not last, but another item is we're expanding culturally responsive training for our provider community, really, again, along with language access, working to make sure that those that are doing the service provision have the resources they need to be successful and to provide the support to households from many different cultural backgrounds. And what's not on the slide that I do want to call out, we've set a goal for ourselves that 100% of our culturally specific organizations receive capacity building resources, recognizing the folks are best served by folks with similar backgrounds and similar experiences as them. And we're really eager to expand our partnership and support with the 7 culturally specific organizations we partner with. All right, and I know I walked through this fairly quickly. I'm happy to take any questions you may have. Hansel.
I wanted to know from the 150 shallow subsidies that you guys are looking forward to giving to our families or individuals experiencing houselessness, are those is rapid rehousing considered a shallow subsidy as well? Like, is that 150 part of the 300 rapid rehousing?
That's a great question, and I'll maybe take a moment and just explain shallow subsidy a little bit in a little bit more detail. This is a newer program we're rolling out that's really designed to help folks that are in rapid rehousing or potentially receiving some supports receive kind of as their income increases or as their stability increases, move them over to a flat rate assistance program versus an income-based assistance program. So that is the 150 is additive to the 300, so it's kind of 450 overall. Great question.
Thank you. That's amazing. Thank you.
Thanks. Shayla?
Yeah, so I'm just kind of curious if in the improvement process, if the voices of the people inside of your guys' shelters is going to be included in this. I'm personally a individual who is currently in the pods, and there's not a lot of representation coming out of these sites for the people that are supposed to be being served. I know there's a lot of providers speaking, but there's not a lot of us from this side of the fence feeling like we're heard or being seen in what we would like to see happen.
Shayla, I so appreciate that question. We are in the process of launching a lived experience advisory committee, and would love to, if you can put your email in the chat, would love to follow up with you about what that committee looks like. I will name it's something that we have as a county need to improve on. We're not doing a great job of getting all of the voices at the table, and something we've recognized and want to include. So that would be a great way for folks to. Oh, and I'm getting a note from Nadia on the side that you're already part of it. So really excited to have you engage and share your feedback that way. And that will be a key mechanism we use to understand what, what the experiences are and how we need to improve our system. But understand that the process is slower than we all would like it to be, and are eager to get that committee launched hopefully this June, or this month rather.
Okay, thank you.
Thank you. And appreciate your willingness to share your first-hand experience. All right, I'm not seeing any questions. And Charlie, Nadia is up next, but she has lost her voice, so I was going to take this agenda item from her.
Okay.
Should I transition? Do folks have other questions? Want to make sure I'm leaving enough space. All right, I'm not seeing any more questions, but if at any time you want to go backwards and ask them, feel free to. The next update, and Shayla, this really, you kind of set me up well to transition into this. We are working with our advisory bodies in the Department of Housing Services and planning a summer listening session, rather summer listening sessions. We'll have one at HSSN at the August HSSN meeting. So you won't have a July HSSN, and then the August HSSN meeting will be a summer listening session of sorts. It will remain virtual, so we'll still be together in virtual community on August 7th, but we have extended the time. So I want to flag this for you now to make sure if you don't have the extended time on your calendar to add it. We'll be meeting from 8:30 to 11. That meeting will have a bit of an introduction to the department's mission, vision, and strategic priorities we've been working on with our advisory councils, and we'll also have conversations about the work of our advisory councils, but the meat of the conversations will be in breakout spaces. So we'll be inviting in, of course, our regular HSSN attendees, and then service providers and partners from our public housing authority side of the house and our development side of the house. So we'll hopefully have a larger table to join us, and we'll have breakaway groups that focus on particular questions or topics that will be kind of staffed by Washington County staff and facilitated by members of our advisory council. So we're looking forward to that conversation. Again, we know it's 2.5 hours is a big time commitment. We appreciate your willingness to extend your normal attendance at HSSN to the listening sessions for the August 7th meeting. And that's part one of our listening sessions. Part two, we are hosting an in-person listening session really geared at kind of members of the community, folks that are experiencing homelessness, housing instability, or have friends or family that are experiencing homelessness or housing instability. That listening session will be a similar format. We'll have a short presentation and small working groups with staff and advisory council members in the room. And again, that one we're really trying to get at folks that maybe don't know about this table, that are not necessarily tracking what's happening in the housing world, but of course housing impacts every single person we know. So that table that listening session is tentatively scheduled for August 19th from 5 to 7. So we're eager to share out that information as soon as we have it finalized. We're still working out the location details and all of those pieces, but that will be a really important kind of public hearing style listening session to hear from members of the public and get feedback on how our system is working, where it's not working, and where we should prioritize improvements, knowing that we can't do it all at once, but we have important work to do together. So I see that there's a question from Lindsay in the chat about a flyer or calendar invite. We absolutely can put together a flyer and send that out through the HSSN listserv. And one thing I forgot to mention is that Nadia will be adding additional information about what I just shared at the next weekly digest for the HSSN listserv. Any questions about either the virtual session or the in-person session? All right, seeing none, Charlie, I'll turn it back over to you.
So we're also going to talk about the co-chair position. Just to cover that very quickly, we're still looking for a co-chair. A few people were interested. I think some were invited to come today. Lindsay, I'm not sure if you have any updates on that, or if you want me to just kind of go over what the co-chair does.
You're welcome to go over it. Yes, if you'd like it. The update that I have, and this is just kind of coming up last minute, so new news. So there are 2 interested people, and because of the voting processes and rules with the COC and this committee, we will likely be doing a vote for those 2 people and whomever else may be interested in our September meeting. But feel free to provide whatever other context.
Yeah, so I'm just gonna read what you wrote, Lindsay. So basically the co-chair, the term is a limit of 2 years. And then at the end of those 2 years, you could choose to be moved into the chair position, as I did. You'd be facilitating the meeting while I was absent, if that ever were to happen, and be included in agenda development. Very, very low key position, and definitely a good resume builder. Anybody is interested in that? Sounds like we have a couple of people, but I'm sure more folks are welcome to express interest and apply. Okay, we're running really ahead of schedule, so that's good. Lindsay Dent is going to talk about SOAR.
Yeah, and before we do,
Oh, sorry,
I was just going to
Cameron.
say, it looks like Cameron has a hand up
Sorry.
and we've got plenty of time, so take your time.
Yeah. Mhm.
Just wanted to see, like, because Charlie mentioned the word apply, so I was like, is there a more formal application process, or is it put my name on the list? Just trying to figure out what the process is for those who are interested.
It's a great question, and I might not have specific answers, but the short answer is no, there's not a formal process for application. A helpful context perhaps is that we recently shifted from that one homeless service system that Nicole shared about, where we really had paid county staff facilitating the HSSN meeting. We've since branched out quite a bit and have really leveraged the value of our community partners to lead and chair these meetings. And so shifting from the previous model to what is now the chair co-chair model is new for us too. So we want to make it as least strenuous as possible. So at this point, it's fairly simple commitment. You've got three specifically county staff that are there to help and do sort of the heavy lifting so that the role and focus really can be for the individuals to facilitate the meetings and also provide input and suggestions on important topics they'd like to see. So no formal application, but we do have requirements from the COC to do a vote. And it looks like Nadia put in to email her, and the information is in the chat there if anybody here is possibly interested in the role.
Great. Okay. And Nadia put that information in the chat. Yeah, so that was helpful just to be able to share that out with people. Thanks.
Questions are good. Are there any other questions regarding the chair, co-chair roles, anything? If not, and Charlie, if you don't have anything else to add, I'm happy to take it over for our SOAR piece of the agenda. I will do my best to talk slow. There's a couple of videos I want to share, but regardless, it's not going to harm anybody if we get out of here today a few minutes early, I'm sure. So I'm going to share my screen. I am hopeful that when I do share the videos, they have sound. Sometimes I have issues with the Zoom settings. So please unmute and let me know if you do not hear the sound when we get to that. So let's see. So I am not an expert on SOAR. I do not work with SAMHSA's SOAR Technical Assistance Office. I do have some experience. I've attended some of the SOAR trainings. I've not been certified. In my previous roles, I've supervised staff who are certified. And overall, from the staff perspective and the participants perspective, it was very well received. And we saw a lot of positive results from utilizing this program and this model. So I'm looking forward to sharing more about it with you. And then we'll get into sort of the whys and the hows here in just a few. So SOAR works, before we really dive into more of the details, I know Meredith has a poll. That poll is just to gauge how many people have or have not received the SOAR certification. So some people may remember on this call, last fall, we had the TA Center rep come and do sort of an overview, a half-day overview of what it is, what it means, and then encouraging people to get certified. As part of our COC NOFO requirements, they really do want to get an idea of the priorities in this area, and SOAR has been one of those that's listed, and so we do want to capture who might be certified. Let's go ahead and answer that poll if you haven't. I'm going to just move right along. So SOAR stands for SSI or SSDI, Outreach, Access, and Recovery. So if you're an acronym person or struggle with acronyms like I can, SSI is Social Security. Okay, so we've got 2%. That's what I expected, especially for this region, and we'll get into why. But that's great that there's a couple folks on here that have been certified. Happy to hear that. So SSI stands for Social Security Income, SSDI, Social Security and Disability Income. So the application process as a whole, probably there's some familiarity here. It can be complicated and difficult to navigate for many people. Several people hire attorneys to assist with this. And so on average, it takes any person about 1.5 years or more to complete successfully an application, of which 30% or so are approved on the initial apply. But if you take into account the population that a lot of people on this call likely work with, people who are experiencing homelessness or are at risk of homelessness, there's often a lot of increased barriers for that population, whether that's trying to make it to appointments because of location or various other reasons that you're all, I'm sure, familiar with. Because of those barriers and the population we're working with, the success rate is around 10 to 15%, so much lower than the population at large. And so several years ago, I believe it was 2006, 2007, SAMHSA, which is the Substance Abuse Mental Health Services Administration, developed the SOAR model to address this need and fill the gap. And let's see here. All right, so this data here, I think it's important to capture the percentages of success, but please note that this is data from 2022. So it's a little bit outdated. I would expect that the success rate of approval is even greater today. But if you see here on the left-hand side, the cumulative outcomes from start of this model to 2022 is about 65% approval on the initial application. And then I think we're looking at 67, 68% approval overall after the appeal process, which is a great increase from that 10 to 15% prior to the SOAR model. And so again, as of 2022, over 62,000 people across the country have been successfully supported through this model. And then I want to take a quick pause to really recognize that not only is there generated income for individuals and stimulating the economy, the 630 million you see there, but there's also real opportunities for people to advance in their lives and whatever their case plan goals may look like, and have some sense of autonomy or self-sufficiency for those who are struggling or unable to work. And that monthly payment can really make a difference in their lives as well. And you've got an average of $6,500 for retro payments, which is great too. So the other data point that I'll point out here is the intake approval, rather than ranging from 1.5 to 3 years, with the SOAR model used effectively, the average time for this population we're talking about is about 153 days. So significantly lower and significantly higher likelihood of success. So this slide, or this video rather, is going to talk a little bit about how to go through the courses, logistically what that looks like. Please note that this is a little bit outdated, meaning their website has been updated since then, so you might have to click a button in a different place, but all of the context and the course amounts and whatnot is the same. So again, please unmute, let me know if you can't hear.
No volume.
What about now?
No, still no volume.
Still nothing?
Yeah.
No volume. You might have to unshare, and then when you go to share again, there's like a button that you need to click that says share computer volume.
Share sound. I was working in the wrong setting. Thank you so much. I hope this is gonna.
Welcome to the SOAR online course Adult Curriculum. This video covers how to navigate the practice case and successfully complete the course. As a reminder, when you enrolled in the course, you signed an agreement that states, in completing the online curriculum practice case managers are required to do their work independently and not copy others or submit joint work. This is a requirement to receive a SOAR Certificate of Completion and 20 CEUs from the National Association of Social Workers. Staff at the SAMHSA SOAR TA Center review each application in detail and check to ensure that this work was completed independently. To receive a Certificate of Completion, you will complete an SSI/SSDI application for a fictional applicant based on materials provided in the course, which includes 5 SSA forms and a medical summary report. Experts at the SAMHSA SOAR TA Center will review your work and provide detailed, individualized feedback within 10 business days. If your application packet is complete and without major errors or omissions, you will receive a certificate. If there are significant errors or omissions, you will be invited to revise your packet and resubmit it for another review. To begin the course, use the navigation bar on the right-hand side of the screen to navigate to Class 1. After reading through the Class 1 materials, you will come to your first practice case page. There will be a practice case page at the end of each class with instructions for completing specific tasks. You will be playing the role of a caseworker who is assisting the applicant in applying for SSI SSDI. You will learn about the applicant using course videos, progress notes, and medical records that you will find on each practice case page in a box labeled Practice Case Materials. In Class 1, you will download and save all of the SSA forms, the medical summary report template, and the instructional guides. If you have any technical difficulties with the forms, please review the video on working with SSA forms for the SOAR online course. You will upload your completed SSA forms and the MSR as you work through the course. Here are some tips for successful completion. We encourage you to review the class articles that explain what each question on the SSA forms are asking. Use the MSR template to help you organize your information. Each section should be thoroughly addressed. Review sample MSRs and the sample completed application in the SOAR library. In Class 7, you will complete a quality review of your practice case application packet. Carefully go through each question to ensure you are submitting a complete packet. You will then submit your packet to the SAMHSA SOAR TA Center by clicking on Submit Completed Application Packet and Complete Course. If you do not click on this box, we will not receive your materials. Thank you for enrolling in the SOAR online course adult curriculum. If you have any questions after watching this video and reviewing our materials, we invite you to reach out to us.
All right, so that's just kind of a quick overview of what the process looks like. Everything's free. The training is free. You would just want to create an online account and then begin the courses. So again, it's online, it's self-paced. You can go at your own pace. It really depends on the learner and the preferences of the person taking the courses. But the online information says that it takes around 20 to 40 hours, maybe a little bit more, maybe a little bit less. There are 7 classes total, like you saw in the video. Within those 7 classes, there's a lot of information, videos to watch, materials and documents to review, as well as quizzes, and then that mock case file that you go through. So they walk you through how to do the MSR and obtain medical records, and they have a lot of great forms and templates so that you can put all of the information in somebody's case in a nice, pretty package to maximize the likelihood of it getting approved from the SSI SSDI review office. So the other cool thing about this, many people might be interested to know that it is eligible for 20 CEUs from the National Association of Social Work. So if you're looking to get some CEUs and you think that this is a good opportunity to really make a difference in the lives of participants you work with, I highly recommend it. Regarding follow-up, it doesn't appear that there's a lot that needs done after you do the work of completing the training and then assisting people through the application process. They do request the case manager or the trained SOAR person submit information and data into the OAT tracking system, and that's really so that they can track information on the national level and ensure that funding for this is prioritized. They have all of the templates, like I mentioned, those are available online as well. The other piece that, if you want to take it a step further, maybe now, maybe later on down the road, our TA Center representative, I'll have their information here at the end. They've indicated that we do not have a leadership organization or individual in the metro region. And so they've really been hoping that there would be an agency willing to step up Now, there's no monetary amount attached to that necessarily, but there's a lot of opportunities for support and additional trainings. They do conferences quite regularly, and there's a lot of technical individual one-on-one support as well. If anybody in the future might be interested in becoming sort of that lead person to make sure that the SOAR model is really maximized in our area. I think that, just personally, me speaking, I think that we could really go far with this and see a lot of success with individuals experiencing some form of disability and needing to gain income from that. So we've got one more video here. And this kind of gets into more of the details of how the process works.
We'd like to talk about the process that the Social Security Administration, SSA, and the Disability Determination Services, DDS, use to process disability applications. This disability determination process has some common elements that are present for the majority of initial applications. However, every application is unique, and a number of things may delay the process for applicants whose applications are not complete or who do not have sufficient medical evidence to document their disability. SOAR works to develop complete applications, provide quick follow-up, and ensure ongoing communication with SSA and DDS. Using SOAR, we can help shorten processing times by submitting medical records with the application, as well as a medical summary report that provides a complete picture of the applicant's ability to function as it relates to work. We're going to take a look at the conventional process and compare it to the SOAR process to show you what a difference SOAR can make. The process begins when a service provider receives a referral or meets someone for the first time. The conventional service provider and the SOAR provider will likely begin in similar ways. They will contact SSA to set the applicant's protective filing date. The conventional provider will do this either by calling SSA, starting the application online, or going into the local office. All of the conventional methods are also available to SOAR providers. In addition, some areas have established a process to fax the SOAR consent form to the local SSA office, indicating the applicant's intent to file. This is where the paths begin to diverge. The conventional service provider will likely give the applicant bus fare and directions to the local SSA field office and encourage them to attend their appointment as scheduled. It is not uncommon for the applicant to miss this appointment, which must be rescheduled. The applicant will then sit with the SSA claims representative and verbally provide as much information as possible. There are often additional required supporting documents that the applicant does not have, which must be brought to the field office on another visit. The application may or may not be flagged as homeless. The SOAR provider will begin an intensive interviewing process to collect complete historical, medical, and functional information from the applicant. The applicant will sign authorizations for the SOAR provider to collect their medical records. The SOAR provider sends those requests out to all of the applicant's treatment providers and continues to follow up for new information. The SOAR provider will complete the SSDI application and the disability report online. They will complete the SSI application on paper and have the applicant sign an SSA 1696 Appointment of Representative form and an SSA 827 Authorization to Disclose Information. Within 60 days of the protective filing date, the SOAR provider will have completed their medical summary report and compiled all available records. They will make an appointment to hand deliver this complete packet to the local SSA office. The SSA claims representative will flag the application as a homeless claim and add SOAR to the remarks section of the electronic file. The next steps are the same for both applications. The local SSA office will make a non-medical decision for SSI and SSDI eligibility. If the applicant is eligible for one or both of the programs, the application will be electronically transferred to the state-operated Disability Determination Services, or DDS, where a disability examiner is assigned. In some states, the SOAR application will be assigned immediately to an examiner who specifically handles SOAR claims. It is important to point out that if the conventional application was not flagged as homeless, it may take longer to get to the DDS and to be assigned to a disability examiner. The disability examiner will look at the SOAR application and review all of the evidence in the file. If they have any questions, they will contact the SOAR provider who submitted the claim as the applicant's appointed representative. If additional information is needed, the SOAR provider will quickly provide it. The disability examiner will be able to make a medical decision on the application and return the electronic file back to the originating SSA field office. SSA confirms the decision and notifies the applicant and the SOAR representative of the decision by letter. Once the conventional application is assigned to a disability examiner, they will begin collecting medical records from the sources listed on the disability report. They will send a request to each treatment source and then wait for the records to be returned. As they start to receive the records, they might notice another treatment source and send an additional request to the new source. Once they have gotten the records, they may decide that they do not have enough information to make a decision, so they may schedule a consultative exam with a contracted physician. Often, applicants who are experiencing homelessness don't have transportation or don't get the appointment notice, and so they do not make it to the scheduled appointment. They must then call the examiner and have the appointment rescheduled. The applicant attends the rescheduled consultative exam, and the consultative examiner has 30 days to complete their report. In the meantime, the disability examiner will have mailed a function report to the applicant and possibly a third party to complete. The examiner may need to contact the applicant to remind them to return their completed function report. An applicant without a phone or stable mailing address can be difficult to get in touch with. When the disability examiner finally has enough information to make a medical or disability decision, they will do so and return the electronic file to the local SSA field office, where SSA will confirm the decision and notify the applicant of the decision by letter. As we hope you can see, providing complete information up front and maintaining ongoing communication with both SSA and DDS will result in applications submitted with a SOAR provider being processed much more quickly, enabling the applicant to start receiving benefits sooner.
All right, so that was a lot of detailed information, but hopefully helpful context to really understand the how and why.
We'd like to talk about the process that the Social Security.
There we go. Okay, and with that, I've got some contact information for you. My hope is that this has inspired you enough to really pursue some of that training and even certification. I do ask that if you do become certified, please let us know. You could let me know or somebody on the HSSN lead team, just so we can support you and be able to track and demonstrate that we really do value SOAR and we want to keep seeing it grow in our region. So the website, these materials will be available on the HSSN website as well, but it's soarworks.samhsa.gov, or you could just Google, type it in. Again, you'll need to create that account, and then it's pretty user-friendly. It should walk you through step-by-step on how to complete those courses. The TA Center information is there on the right. It's located out in New York. Our point of contact for Oregon is Dan, and Dan's been very helpful, so feel free to save their email, reach out with any questions you might have. And also, Dan would be the point of contact if you were interested in more information on becoming one of the SOAR leaders in our state. So thank you, everyone. I think we have a couple of minutes for questions, if there are any. Go ahead, Charlie. It doesn't look like there's any questions or hands up. Oh, sorry, I didn't see that. Cameron.
Only anecdotally that I've gone through the training, but not like submitted, like I haven't clicked that button, because it was honestly a little overwhelming. And right, I saw Chantel on camera, so thanks for that, because yeah. But also like, wow, it's still a great opportunity to like go through, like sign up and look through and click through, even if you don't get certified, because then you know like what to expect. And like you can kind of, by knowing that process, kind of do some initial screening with the people that you work with, knowing like if they could even get approved, right? Knowing like what their barriers are to get the documentation, and like go, just kind of like, it's a really great free education of like the process and what's required. And if you like can fill out paperwork and like really get through it and like click that certification, that's great. And at the very least, it's really helpful to educate the people that you work with on what they're really up against to get that approval and to like be the best applicant you can be to get approved, right? Because that last video really just shared that that documentation. Like if they try to do it themselves, like they tend not to have it done correctly. And it's like, yeah, because it's gotta be documented. It can't be like, personal experience. It's really gotta be like all laid out. And that is such a huge barrier for a lot of people, thinking that they could get approved for that because they need it, but not on paper. It doesn't look like it. So just kind of, it's worth clicking through, reading at your own pace, at least learning the process and learning what is all required. So
That's a really good point and a good call out that it's effective information for anybody to have, but also we don't need to sugarcoat it, and it's not simplistic, right? It is intensive. One thing, just personally, my experience has been, just like Cameron said, being able to determine if somebody could be eligible based on this model, if they have enough of that medical record that they need, or if not, maybe what are the steps to get there? So it's quite a bit of training. It's a lot of paperwork. We all have busy work lives and caseloads, and so I definitely don't want to imply that this is simple and you're going to give everybody a bunch of money and disability approvals, because that's not necessarily the case. But at the same time, it's valuable. Shayla.
So I just wanted to offer some input on that. I actually am on SSDI myself, and I went through the process alone. It was very taxing. Fortunately, I did get approved the first time I did it. But sometimes it can be helpful not only with those type of trainings, but also to talk to people who have had to do it on their own. I've been able to help other people, like when they're filling out their paperwork and stuff, and kind of explain like the answers that they need to hear before you even get to like the step of providing medical records, or how to do that, or to make for sure there's emphasis on like certain things. And so I think it's really important also to remember, not only with the training, but maybe also seek the input of people who have had to jump through those hoops without assistance. So I just wanted to share that.
Yeah, can be super valuable, whether it be other case managers or other people whom have applied and had to go through that, definitely. Any other questions? I think I'm at time. If there are questions, feel free to drop them in the chat, and then I think Charlie's gonna bring on our next speaker. Thanks, everyone.
Yeah. So we're just going to move into general business. The first thing was the Solution Council update. I know Nadia has lost her voice, so Nicole, or I'm not sure if somebody else is going to take over this portion.
Yeah, Charlie, I'll give a brief update on the Solutions Council. The Solutions Council, as folks know, is our parent advisory body overseeing all of the work we do here in the Division of Homeless Services. They met most recently last month to discuss that transitional housing funding offering I mentioned during the work plan update. So they provided some guidance and feedback on that, and also provided guidance and feedback to our colleagues in the Community Development Department on the Emergency Solution Grant funding. So that was the topic of the last meeting. At the upcoming meeting in 2 weeks from today, the Solutions Council, well, 2 weeks and a day from today, the Solutions Council will be discussing, hearing an update on the Metro's effort to review the supportive housing services measure and potentially refer the supportive housing services measure to fund housing development. So we'll be having an update from Jess Larson on that at the Solutions Council. We'll also be chatting about the listening sessions that we mentioned, getting some of the advice and guidance from our advisory body. And then if we have time, we'll go into a coordinated entry presentation, but we might need to table that because an hour is not that much time for all of those topics. So we're looking forward to those conversations. I'll go ahead and put the link in the chat here just so folks know where to find meeting materials, information about meetings. As a reminder, these are public open meetings. You can join us in person or on Teams, or excuse me, on Zoom anytime. Happy to answer any questions, but that link there has also quite a bit of information in it.
Okay, if there are no questions, we can move on. Next up, we have the Access Center NOFO updates, and either Jesse or Michael, if either of you are here, will be taking that over. So whenever
Absolutely.
you're
Thank you.
ready.
Hello, everyone. My name is Mike McLeod. I am a strategic project specialist at the Homeless Services Division for Washington County. As you may recall, I joined HSSN a couple months ago to give some information about the Access Center Notice of Funding opportunity that the county was releasing. I am happy to share that procurement has now closed and most of the evaluations are now complete at this time. We did receive a total of 4 applications. The NOFO asked for applications in 4 geographic areas around the county. That was Southeast County, Hillsborough, Beaverton, and West County. We have received approval from the Board of County Commissioners at this time to fund 2 of those applications. So congratulations to Project Homeless Connect in the city of Hillsborough and Just Compassion in the city of Tigard. They will be receiving their funding in the next couple months. So those projects will get underway, which is awesome. For the city of Beaverton, we received 2 applications, and that is still an ongoing procurement at this time, so no decision has been made. And as for the West County Access Center site, we have not received any applications at this time. So Washington County is planning on reopening the Notice of Funding opportunity a little later this summer in hopes that we receive some applications for that. So really excited to get a couple of these projects going here at the end of this summer. And aside from that, we will keep you all updated on when that other Notice of Funding opportunity is opened and what the evaluation determination is for the City of Beaverton site. I can go ahead and drop my email in the chat if anyone has any other questions offline, and then I can answer any questions now. I see there are some. What would be considered West County? I mean, that's kind of up for interpretation, right? I mean, we're not really like drawing any lines on a map or anything, but West County would essentially be most likely Forest Grove, Cornelius, and basically west of Hillsborough would be my understanding.
Okay. Thank you, Michael.
Yeah, thank you.
If there are no other questions, we can move on to the quarterly veterans update. Gareth Smith is going to update us on that. So Gareth, whenever you are ready, go for it.
Good morning, everyone. Yeah, my name's Gary Smith. I work for the VA Medical Center, which is called the VA Portland Healthcare System. And I've been a social worker there for about 15 years now, working in the VA homeless programs. I've been connected with Washington County for many, maybe 14 of the years. And so we have our veteran by name list group that's meeting every first and third Monday from 1 to 3. And just going through the list of veterans that we're getting on there, and a lot of them are with our Salvation Army program in Beaverton, but a lot of them are also in the different shelter programs or just getting signed up through HMIS. So we try to find ways to track those situations and really connect with those veterans and find ways to either get them in a program for housing or maybe connect them with a VASH voucher or find ways to improve their situation, get them permanent housing. So that's been going well. I know Carrie Williams gave me stats. That was through April. I think it was from last July through April. And it looked like we had over 260 veterans on that veteran by name list. And I think we had gotten about 80 of them housed. So we're, doing a pretty good job. When I look at our Salvation Army program in Beaverton, and I'll talk about that here in a bit, but we're always doing an excellent job there. I've appreciated my eight years of working with that program. Another big topic is our VASH vouchers, which are the VA supportive housing vouchers, kind of like Section 8 vouchers, but they come with a VA social worker that meets with the veteran and does continual case management with them. In Washington County right now, we have about 272 of those vouchers. And I think in use right now, we have 228 of them housed. So there's about 38 are kind of in the works. So a lot of those vouchers are spoken for. So it's gone quick. The list is still around 77 veterans on the voucher list. So definitely not enough vouchers for all the veterans on the list, which becomes a challenge and is always difficult. But having our resources like SSVF, the supportive services for veterans and families that Community Action runs, is an excellent resource and an excellent support that helps a lot of our veterans out with temporary subsidy and move-in costs and all kinds of other things. Yeah, and accessing those vouchers, I'll make a little plug for our Community Resource and Referral Center that's in downtown Portland. A lot of times veterans can just make a phone call down to that Community Resource Center, and it's where we have a lot of social workers that work out of there. We also have a doctor, we also have nurses, but it's a good way to connect with the VA. You have to be an eligible veteran, so that eligibility can be a little tricky at times. If you're a reservist or National Guard that was never deployed, you would probably most likely not be eligible. And if you have a dishonorable discharge, those are kind of the few things that would not make you eligible. But connecting with that Community Resource and Referral Center in downtown, and I'll make sure that we get a brochure out for that program, just because it's an amazing resource center for our homeless veterans. And I got to make a plug also for our Salvation Army program in Beaverton. It's got 48 grant per diem beds, which are transitional housing programs for veterans that are houseless. And we have 48 of those in the project. And then we also have 10 emergency transitional housing beds. So we've done, they just had a capital grant and it's primarily done, but the building had some water damage, so we're struggling on having a lot of openings right now. But we will have those openings again. We continually do have openings every Thursday. We have a screening there at 9:00. It's at 14825 Southwest Farmington Road. And I can't emphasize enough that it is more of a program for veterans. There's curfew, there's case management, there's random UAs, there's breathalyzers twice a day. We have children and families, a lot of service and therapy animals. So it's a big building that's for veterans. And to me, it's been a great place for me to be working with the Salvation Army on helping our veterans. So yeah, I really appreciate your guys' time. If anybody ever has questions, feel free to reach out to me.
Awesome. Gary, would you mind, just writing your email in the
Yeah.
chat, just in case anybody wants to reach out to you? If there are no questions, I will move it to Lindsay for announcements.
I do have a couple of announcements. I'm putting one in the chat now. As always, I like to remind everybody about the upcoming learning communities. So learning communities are an opportunity to hear from experts in the field in our neighboring communities about deeper dive topics. So they're always the second Wednesday from 10 to 12, and they're open to our contracted providers as well as HSSN members. There will be more information in the chat here in just a moment. This month's on June 12th, the topic is harm reduction, drugs, how to support people and refer to treatment services, etc. And we'll be hearing from our sheriff's office as well as the BHRN representative, Nancy. So again, that will be June 12th from 10 to 12. It is going to be hybrid, but normally if you've been to a learning community, you know we normally meet at the Washington Street Conference Center. This month only, we will also be meeting, well, in lieu of the conference center, we'll be meeting at the Public Services Building. So that information is available to y'all. The last thing that I have for an announcement is just by happenstance, there's some funding available for individuals who work in a public housing setting or project housing, outreach, or shelters to receive harm reduction supplies. So needle exchange items, naloxone, several other things. I think there's wound kits available. This information hasn't gone out to providers quite yet, but if that is something you or your agency would be interested in and you need it quickly, I believe funding runs out the end of this month. Please reach out to me. If you don't, you'll be hearing from me likely in the next day or two about more information and how to order those. So those are the information or updates, announcements that I had. If there's any other announcements, I think now's the time to either put it in the chat or unmute.
Chantel did have a question. Do you guys have regulations in Washington County about what shelters can provide as far as harm reduction supplies?
I do not have an answer to that question. I'm sorry about that. I do know that it is Washington County Public Health and Homeless Services Division defines best practice as harm reduction.
Anybody else that wants to possibly chime in if we have like maybe a shelter worker on the call or anybody that could know if there are any regulations to answer that question?
To like kind of give you an example of why I ask, I come from working for Measure 110 in downtown Portland. And even though it's harm reduction funded, they still wouldn't allow us to give clean needles. So I just wanted to know. That's a different county, that's Multnomah. So if Washington County has other like specifics, they actually like still wouldn't even let us give suture kits and stuff. So it was like super limited, even though it was a big harm reduction push through Measure 110.
So just looking it up, it says that what Washington County has on their website, it says harm reduction. Oh, sorry. Let's see. Services offered must be at least 18. Yeah, it's just referencing the needle exchange. So sterile syringes, disposal of used syringes, wound care kits, safe sex materials, rapid HIV testing, Noxolone, and fentanyl test strips. That's what they have on their website, and they also have where to go. It's held Mondays 2 to 4, and also on Wednesdays at a couple of different locations. That's what they have listed on their website. So
I do know that the county has a needle exchange point of contact with public health, so I'm happy to pull their email and provide it to you.
Looks like Nicole said I just chatted a program staff member and they said there were no regulations. There are also no requirements. Shayla, do you have anything to add to that? Whenever, go for it.
Yeah, actually, I feel like this is kind of on topic for something that's recently been going on in the shelters. I have some concerns that shelter providers actually do not even carry Narcan, and there is an increase in drug use going on. We've also had history of staff members using unlock. So I just wanted to mention that I would like to see the county maybe provide kits or something to the staff to have an office while we're on that subject.
Great, yeah. And just by chance, did you want an email sent to maybe like an appropriate person to, I don't know, just make that suggestion, or have you reached out to? Okay.
Well, I mean, I
figured.
brought it up to different varying people via grievance, like that I filed here, plus I've sent out to county members and city members. However, I would just really like to point out that we do have a drug issue going on site in these shelters, and that there doesn't seem to be any protective anything is going on, which is really alarming, because if we have like an overdose here, you know, nobody's prepped for that, it seems like. So
Right.
So just quickly, I don't want to misspeak, so I haven't really spoken on it. Leslie, if you happen to have information on this, feel free to step in. What I do know is that the previous model of how harm reduction is supplied to the county is coming sort of to an end, and that's why we have this push for by the end of the month, beginning the new fiscal year, there will be a hub site, so to speak, where any shelter or outreach provider at any time will be able to restock on harm reduction supplies, including Narcan. And the goal is that every shelter has ample Narcan early next fiscal year, so within the next couple of months at any given time. So we are actively working on that. Public health and behavioral health have this population that we work with as the top priority for populations that they can provide the supplies to.
Awesome. Thank you. We also have in the chat, Melina said, not sure if this was brought up, but Save Lives Oregon Harm Reduction Clearinghouse is a service where providers can set up an account and be provided with free harm reduction items, including naloxone, Just Compassion, and also Just Compassion just got their account set up, and we now have access to over 200 harm reduction items free to us. SEPA also did that. And we were able to get it approved pretty quickly. So it's not like the process.
Yeah, I figured I would stop.
Take very.
I figured I'd stop typing and just address it. It did take 90 days to set it up, but in the interim, they will provide you with naloxone. So I was able to get 120 doses of naloxone to bridge that gap. And we just started to place our first order yesterday. And our prorated amount until the end of June was $24,000. So you get an amount each year. And so that'll roll over, or that'll start again in July. The money won't roll over, the unused money, but that's kind of what we're leaning on right now for our harm reduction items for our outreach program. And so, yeah, it was a pretty seamless process to enroll. It's just the waiting period because they have to connect you with a provider. So we were connected with Cardinal Health. So
awesome.
Yeah.
Thanks. And then Leslie did provide the link that I referenced earlier on the harm reduction strategies from Washington County. If you'd like, you can check it out. And otherwise, it looks like we are at time. So thank you for participating in this meeting. It is very valuable to us and to the community as a whole. And I hope you all have a wonderful rest of the week. Bye, everybody.